Hello students, very good morning. Today we are going to start Political Science, chapter number 2, Role of the Government in Health. So let us start. First, we will start with the introduction parts. In the introduction parts, let's read something on what are the roles of government in health sector. What we will going to learn in this lesson, objectives are understand how the government makes decisions to improve the health of the people. Learn about the concepts of health and healthcare in India. Know about the types of healthcare facilities in two types of sectors, private and public. See how the politics affects who gets what services in terms of public health care with examples from Kerala and Costa Rica. Overviews are health is our ability to remain active in our work and daily lives. India has a huge network of public, government run, and private hospitals and medical colleges, yet, many people even today have to do without clean water, nutritious food, and proper healthcare services. The government must help everyone or every individual get equal access to necessary healthcare services. Now, let us see the key concept of the chapter. It will help you out to understand the chapter in a clear manner. Short notes on topics related to the government's role in health. By the introduction, people in democratic countries such as India accept the government to work for their welfare, usually by providing services such as affordable houses, basic education, good health care, productive employment, etc. In this lesson, we look at what government do for people's welfare, particularly in providing health care services to the people. Let us see about health. Usually, being healthy means being free from diseases. But in the modern world, health also means doing active work and being in good spirits. People often fall ill if they do not have clean drinking water or nutritious healthy food, if they live in polluted places, or if they are under a lot of stress. Now, the next point is the Indian health care system. India is the fourth largest producer of medicines in the world, but India also has one of the largest population in the world, and a lot of resources and planning are needed to provide all Indians with good healthcare services. Many people even today don't get enough clean water to drink, clean toilets and neighborhoods to stop the spread of diseases and nutritious food. And although many Indians become doctors and nurses, most of them take up jobs in the cities. So the people in the villages either don't get good health care or have to travel long distances to get medical treatments. India also gets a lot of medical tourists for their treatments, which results in further shortage of medical services to the poor. In order to prevent and treat illness, we need proper healthcare facilities such as health centers, hospitals, laboratories for testing, ambulance services, blood banks, etc. India has a lot of knowledge and experience in the field of healthcare and its public run by the government. Healthcare system looks after many peoples across India. Now, let us see first system of healthcare in a public healthcare. We will read about first public healthcare. The question will be arise in your mind, ma'am, what is the meaning of public healthcare? So let us see. The public healthcare system is a network of clinics and hospitals run by the government in both rural and urban areas. Its health workers, nurses are trained under the supervision of the doctors at the primary health centers. It is called a public system because it has to provide healthcare to all of the nation's citizens, and also because the public health centers get their funds from the taxes paid by the general public. Another important function of public health care is to prevent the spread of diseases such as tuberculosis, malaria, etc. This can be done only when the government and the people of the country work together towards being healthy. Now, the second point is private health care. As the name suggests, the private healthcare system is not owned by the government, and India has many private healthcare facilities such as clinics, hospitals, laboratories, colleges, etc. Many doctors practice in their own private clinics, and many also provide specialized treatments. In fact, there are now many large companies that run network of hospitals or manufacture and sell medicines on a large scale. Let us see inequalities in public health care. Although India is a democracy, not all Indians get equally good health care. This is because the population of India is huge, and also because most new medical staff and facilities are in the cities, whereas most Indians live in villages. Also, most healthcare systems in towns and cities are privately run for a profit and are too expensive for many people. Barely 20% of the population cannot afford all the medicines they need. According to one study, 40% of the patients in hospitals have to borrow money or sell their possessions to pay for their medical expenses. Now, let us see inequalities in public health care. First, we will see solutions and conclusion. In a democratic country like India, it is a responsibility of the government to provide proper health care facilities to all its citizens. Basic medical facilities should be available to everyone, everywhere, and not just to rich people in the cities. Our countries, government, and people have to work together to improve the health of the nation. Now, let us see the Kerala experience. In 1996, the government of the state of Kerala gave 40% of its budget to the rural panchayats and the freedom to plan and provide for the needs in their villages. This led to some positive changes as the money was used for the betterment of all the facilities in the village. For example, proper planning was done for water supply, education, working of schools, etc. The Costa Rica approach. Many years ago, the Costa Rican government took a very important decision of not having a national army. This meant that all the money which was used to manage the army could be used for others, more useful projects such as health, education, and meeting other basic needs of the people. The Costa Rican government took this step because It believes that a healthy population is the most important factor in the development of any country. Role of the government in health, let us see. Some reads we will do it. The National Rural Health Mission NRHM was launched in April 2005 by the Government of India. The goal of the NRHM was to provide effective health care to rural people with a focus on 18 states which have poor public health indicators and or weak infrastructure. Elderly population still growing and is forecast quadruple to 221 million in 2050. This is likely to compound the healthcare challenge facing India in the coming years. In 2012, India was polio free for the first time in its history. This was achieved because of the Pulse Polio program started in 1995 to 1996 by the Government of India. 828 million urban residents live in slum conditions worldwide. 37% of 161 countries do not have national standards or recommended list of medical devices for different types of healthcare facilities or specific procedures. Completing 3 full years without reporting any case of polio, India celebrated a landmark achievements in public health on 11 February 2014, the victory over polio. Foreigners in increasing numbers are now coming to India for private health care. They also come from Europe and North America for quick, efficient and cheap procedures. A shoulder operations in the UK would be cost $10,000 done privately. In India, the same operation can be done for $1,700. Universal health care, sometimes referred to as universal health coverage or universal care, refers to a healthcare system that provides healthcare and financial protection to all of a country's citizens. Indians are 3 times more prone to heart diseases than Europeans. Heart attack is the number 1 killer there. Indians need 2.5 million heart surgeries a year, but only 90,000 of them actually happen. And India produces just 80 cardiologists a year against 800 in the US. Now students, this is all about the chapter. I hope you understand each and everything or every topic. Dear students, if you have any doubts, any query, you will freely to ask me in a live session. Till then, bye bye. Take care.